Baruch here with genConnect.com, and I'm joined today by Dr. Paul Gannon, who focuses on naturopathic medicine. How are you, Dr. Gannon?
Great. Thank you for having me.
Thanks for being here. Let's start off for a second. What is naturopathic medicine?
Naturopathic physicians are trained as primary care physicians, and our medicine goes back to the 1800s. We were the eclectic physicians, doing herbs, homeopathy, diet, nutrition, and we still are. The profession is coming back after many years of a lull, just when we were looking for science to save us from all of our medical woes. And now we realize that with preventative medicine, which naturopathic physicians are really experts at, that the healthcare system can reform, save money. For every person that is prevented from getting diabetes, the healthcare system is saving hundreds of thousands of dollars over their lifetime.
What are the biggest things, the best steps that people can incorporate into their lives right now to prevent disease?
Well, I start with diet and what someone is putting into their body. So I have cooking classes and cooking videos online that I offer and on my website, and lots of information about food and nutrition. And a lot of people say, how do I know what to take in terms of supplements? And they also say, how do I know what foods are good for me? And they read that pineapple is good. Well, it might be that you're allergic to pineapple, and that might be actually causing your arthritic pains or your hay fever to flare up or your immune system to be weakened. So I really work with each person to figure out what is unique for their makeup, what is unique for their composition to keep their immune system strong, to let their body work the best way possible, because the body will always find healing. It will always strive for that middle ground. You just have to remove the obstacles and it will find its path to true health.
What do you think are the biggest obstacles that really are preventing people from achieving the best health possible?
I would say food, once again. And you know, like a lot is coming to the fore right now with gluten, for instance. You pretty much are seeing gluten-free anywhere you go in the country now for the first time. And I believe that this is because there is a test that can measure certain proteins that the body reacts to, the gluten proteins. So these antibodies that are attacking the gluten proteins. However, it's come into the mainstream medical fore because of these tests. However, I find that patients, whether they are positive or negative for these tests, I don't even do these tests, that they say, well, I can handle gluten, but I can't handle wheat. So we are looking at many more compounds in foods that are potential allergens, more than just gluten, which is pretty much what the mainstream medical system is now looking at, is just gluten. But as a naturopath, I'm saying, well, it could be wheat and not the gluten. It could be some other compound.
But diet.
Diet. So if you have any pain, if you have any skin complaint, if you have any itch that is chronic, that you might have had for years, think of a food and find a naturopathic physician to work with who will really look at your intake specifically to figure out so that you can be the best health possible.
Dr. Paul Gannon, thank you so much.
Thank you, Baruch.
And for more with Dr. Gannon, be sure to check out genConnect.com.